Sadness vs. anxiety. All you need to know. Sadness and anxiety are common mental health conditions affecting a person's day-to-day life. You've probably heard these terms used interchangeably. However, getting an accurate diagnosis is important to treat the right conditions. We'd have tried to hit the nail on the head to let you know about sadness vs. anxiety. Sadness is an emotional pain associated with loss, but anxiety is a persistent feeling of worry or fear. It can be mild or severe. Read on to learn more about sadness vs. anxiety. Does anxiety come from sadness? Many people have both anxiety and serious depression. Anxiety can be a symptom of serious depression. Depression caused by an anxiety illness, such as generalized anxiety disorder, panic disorder, or separation anxiety disorder, is also frequent. What is the difference between sadness and anxiety? Most people feel difficulty identifying the difference between sadness and anxiety. A key difference between anxiety and sadness is that one relates to a specific sickness, while the other relates to various illnesses. One of the main reasons for this confusion is that both of these disorders have overlapping symptoms. Some sharp differences between sadness and anxiety include: these conditions are sometimes treated with different medications. Another difference is when you suffer from anxiety, you will experience excess worry. On the other hand, suicidal thoughts are common in sadness. What is sadness? Sadness is a type of emotional distress accompanied or defined by feelings of disadvantage, loss, despair, helplessness, disappointment, and sorrow. When someone is depressed, they may become quiet or lazy, and they may withdraw from others. A survey done in Colombia between September 2020 and September 2022 discovered that approximately 16.4% of women and 11.8% of males reported emotions of sadness in the 7 days preceding the survey. According to the same survey, sorrow was one of the most common symptoms associated with mental health disorders, as reported by approximately 12.8% of interviewees. What is anxiety? Worry and fear are normal parts of life. But when you feel uneasy and persisting, it can be a sign of anxiety. Anxiety is a natural human reaction when we feel threatened, which can be felt in our thoughts, feelings, and physical sensations. If you frequently experience the following symptoms, you may suffer from anxiety. Worrying has taken over my life. Sweating or trembling, cranky or tense. You appear to be out of control. In Scotland in 2021, 10% of men and 18% of women experienced 2 or more anxiety symptoms, indicating that their anxiety was moderate to severe. Symptoms. Several fundamental distinctions can aid in distinguishing between depression and anxiety symptoms. Anxiety. Anxiety can have the following symptoms: restlessness, difficulty concentrating, panic attacks, rumination, isolating yourself from others, feeling fatigued, sweating, anxiety chest pain, nausea, obsessive thought patterns, insomnia, irritability, changes in appetite, depression. The following are included in the depression symptoms: loss of interest in your favorite activities, hopelessness, unexplained aches and pains, anger, irritability, and restlessness, a lack of energy, changes in weight and appetite, chronic fatigue or sleep problems, difficulty in concentrating, feelings of guilt, worthlessness, or helplessness, suicidal thoughts. Overlapping symptoms. While it's important to realize that not everyone suffering from depression, anxiety, or both disorders will have the same symptoms, the two conditions frequently share similar symptoms. Symptoms of either illness may include changes in sleep patterns, difficulty in concentrating, changes in energy level, increased irritability, aches and pains. Rumination can occur in both situations. Rumination is a continual loop of dark, sorrowful, or negative thoughts. You may not want these thoughts, but you can't get them out of your head. You may experience the following symptoms as a result of anxiety: trapped in a cycle where you investigate all the possible outcomes of a problem, unable to stop thinking about all the things that bother you, even when you know you can't do anything about them. You may experience the following symptoms as a result of depression: guilt over not having the energy to spend time with friends, going over past events and blaming yourself for things over which you have no control, including feelings of depression. Treatment. Anxiety and sadness are treatable mental health problems. A mental health care specialist may advise combining therapy techniques because what relieves depression symptoms may not necessarily relieve anxiety symptoms, and vice versa. Potential treatments for anxiety and sadness include therapy. Following therapies can treat your anxiety or depression. CBT teaches tools for identifying, challenging, and changing problematic ideas and behavior patterns. Mindfulness-based cognitive therapy teaches mindfulness skills as well as behavioral techniques to assist you in starting to manage undesired feelings and staying present through them rather than becoming overwhelmed. Acceptance and commitment therapy provides skills for accepting undesired or painful ideas, remaining present at the moment, and committing to constructive actions that satisfy your unique beliefs. Therapy for problem resolution. This method teaches how to employ coping skills to deal with mental health symptoms and life events that create stress and other emotional upheavals. Medications. We can also treat anxiety and depression with anxiety psychotropic medication. However, it does not help you address the underlying source of those symptoms. Therefore, your doctor or psychiatrist will usually recommend counseling in addition to medicine. A psychiatrist or other professional may prescribe. Antidepressants include selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs. In some situations, these drugs may also help with anxiety symptoms. Anti-anxiety drugs include benzodiazepines, buspirone, Buspar, and beta blockers. These drugs may alleviate anxiety symptoms, but may not alleviate depression symptoms. Because benzodiazepines have a high risk of addiction, your doctor may try other drugs first. Mood stabilizers. These drugs may help treat depression symptoms that do not respond to antidepressants alone. Final thoughts. Sadness vs. anxiety. Sadness and anxiety are both normal mental health issues. Anxiety is characterized by excessive concern and fear, whereas thoughts of hopelessness and despair characterize sadness. Both circumstances may be present at the same time. Anyone who sees mood changes or signs of anxiety or depression should seek medical assistance. People suffering from anxiety, sadness, or both can seek treatment and support from online and in-person support groups. We hope you get your head around this post. Sadness vs. anxiety. Know everything. Remember that you are not alone and that treatment is available for you. If you have any queries, let us know in the comment section. Visit Mindcope to learn more.